Hello, gentlemen. Welcome to this presentation on some of the work that we've been doing to better support BGTQ plus and MSM men that have been facing prostate cancer. We're so excited to be talking to you, showing you some of the work that we've done and also some practical tools to better support you on this journey.
Yeah. I'm Rob Rutledge. I'm a radiation oncologist. I've been treating prostate cancer for, almost 30 years now, and very excited to bring my experience as an oncologist and the incredible work we've done working with so many men from the sexual minorities who can really help us improve your quality of life.
And I'm Gabriela Ilie. I've been doing research on quality of life issues for the past 20 plus years. I'm an endowed scientist in prostate cancer quality of life research in the Faculty of Medicine here at Dalhousie University. So excited to be doing this work. Here are some of the items we're going to be talking about: the medical system and the GBTQ plus MSM community, treatment side effects, the whole truth.
Yeah.
Prostate cancer patient empowerment program, this intervention that we developed and that we're working very closely with the gay men in our program to better support you. And then just specifics about this program, how you can get involved, how you can get registered, and how we can be part of the bigger community.
We also want to recognize that we're doing this with a greater purpose, and we really want you to join our community, right? So if you can get this material out into the world and support other men in the community, it'd be extremely helpful. And so what we really want to do is increase the awareness of prostate cancer within the community, and therefore have men screen more often, get their PSA blood tests done, and then ultimately the men can actually advocate. You can learn how to advocate for yourself to get better treatment, better care, and therefore better outcomes, and then ultimately bring that back to the community and really make a difference in the lives of all men. I talk about the experts, which is kind of us, but then the real experts is actually men from the community who've lived the experience. So we have that experience. We're also talking about the scientists who have actually interviewed hundreds of men from the sexual minority community and garnered that information. We're going to offer that to you today. And as Gabriela has talked about, we've developed this program. Hundreds of men have been through this program since 2020. We recently garnered a Movember grant, incredible grant, and that is meant to adapt the program for the vulnerable communities. Yeah. And part of that, in the next slide, we'll actually explain a little bit more about that. But the idea is that we actually brought together 15 men from the GBTQ plus community and had them feedback. What is it that we need to do to adapt the program for your needs?
And also, how can we outreach? Because you might think, well, you have a really good program. You should be able to get through the men that need it most. Well, it's not that easy. Yeah. And so we put our heads together in terms of, how can we do this more effectively? But also, how can we stay close? Because nobody wants to leave. We all are here for the long run. We want to support. We want to become mentors. The men themselves, if you go on our website, you'll see podcasts that they've done. They've helped us reach out to their own communities throughout Canada to let men know that, hey, listen, you have a prostate cancer diagnosis. You're not alone. We're here to support you. And there are some things you can do at home. And the doctor can't come in your own home to tell you what to do, but in terms of nutrition, in terms of how you move your body, that can really support you.
Really make a difference. Exactly right.
Yeah.
And some specific programming for the community as well. So
this year we were awarded a Movember grant, and part of it is, again, to modify the program to better suit the needs of various vulnerable populations, among them the GBTQ plus MSM community. I'm excited about that because we have a very, very strong group of participants that went through the program. They were buddies, that now they're mentors, they're doing podcasts, they're really out there with us. So we're working together. We call them our research citizens to really raise awareness and change the program to some extent to better suit the needs of this particular population. Part of it is this video to raise awareness, to let you know what's in the program, what are some of the things that you can do, and also give you a little overview of the program and how can it suit men in your community. Part of the program was examining the results of 20 to 30 men that go through the program, making those modifications, and then reevaluating the program at that point. So we're really excited that you're watching this video, and we hope that you join the program.
So the next section, we want to talk about the experience of men from the community and their experience within the medical system itself, right? So, and so we're drawing on the best of science around that. So The first study was actually what they call a meta-analysis. We're looking at all of the published literature up to 2017. There were 88 different articles that they looked at. Actually, 5 of them were case series around transgender women and prostate cancer. So very extensive research. So what the literature shows is a number of studies, and the first one is a meta-analysis entitled Understanding Prostate Cancer in Gay, Bisexual, and Other Men Who Have Sex with Men and Transgender Women, a review of the literature. So they looked at 88 articles, so published articles from the literature in which the scientists were actually interviewing men from the community. And what they found through kind of a summary of all those articles is that men in the community were less likely to receive regular PSA screening, which is worrisome, right? So they're less likely to be picked up early, less likely to kind of be cured of their prostate cancer.
Chances of more advanced disease.
Exactly. And the second thing is the men going through the treatment had worse urinary, bowel, and overall quality of life outcomes. So they weren't doing as well in the long term. So that was the first big analysis. The second one was actually an interview of 347 men from the GBTQ plus community. And essentially, it showed that nearly half of these men, 49%, reported experiencing discrimination, right, during their prostate cancer treatment in some way or other. And that about a third, 35%, said that this was related to their sexual orientation. So that's tough that people are actually experiencing that. And that this ultimately, there was a link between feeling discriminated against and having poor quality of life. So we want to kind of change this by kind of empowering you as to how to work with the medical system, I think is it.
And then there's another literature review that was just released, 2025. And so what we're seeing here is a review of 16 articles looking at men from UK, US, Australia, Canada, of course. And they found that 78% of studies reviewed reported worse sexual functioning and satisfaction among gay and bisexual men after prostate cancer treatment compared to heterosexual men, particularly related to anal sex, loss of ejaculation, and erectile dysfunction. Over 2/3 of gay bisexual men participants described unmet information and support needs within the medical system, noting that the medical materials and counseling were framed for heterosexual men and excluded the same-sex experiences. And of course, with that lack of information comes a sense of disempowerment, and mental health goes up, quality of life goes down. More than half of the GBTQ survivors reported feeling uncomfortable disclosing a sexual orientation and sexual practices for healthcare providers. And again, leading to increased mental health issues and poor quality of life.
Poor mental health, yeah.
And I think that's important because you look at prostate cancer, and recently we gave a talk on mental health. And what ends up happening, at least now when we're doing this presentation, men tend to go through the back door to a healthcare provider in the community and say, look, I'm not feeling very well. I'm really going through a rough time now that I've been diagnosed. And the primary form of treatment for mental health in the community at this moment when we're doing this presentation seems to be, benzodiazepines, medication that interferes negatively with, say, hormonal therapy for prostate cancer. And it is quite a conundrum. We're, all trying to raise awareness. We have scientific studies that are trying to shed a light on this issue. But what ends up happening, the oncologist doesn't know what, the private practice community medical doctor is prescribing. So instead of going for what would be best, seeing a clinical psychologist, less than 1% of men see a clinical psychologist. So instead, we're going for medication that oftentimes interferes with the medication that we offer men for prostate cancer.
This is a smaller study of 24 men. And essentially, I think the quote says it all. Ultimately, you realize you're on your own, right? Which is actually true for most men going into a prostate cancer diagnosis. But essentially, the study found that the men were reporting significant communication barriers with their healthcare providers, right? So challenges in disclosing their sexuality and relationships, and limited discussions, again, around treatment options and treatment side effects. And that the men were also experiencing higher rates of rectal dysfunction, right? Rectal discomfort, I'm going to explain this shortly, and reduced sensitivity compared with heterosexual men. Right. So we need to kind of do better. So I want to try to explain to you why there can be changes affecting sexual health within gay bisexual men post-surgery, for instance. So the scene that you're seeing right there is actually radical prostatectomy using a robot. So that's what it's called, basically the cancer surgery. And what happens during that is that in the top diagram, you see the prostate is in place, there's a tumor there, and the surgeon is going to remove the prostate gland and the seminal vesicles. The seminal vesicles are the ones that actually produce the semen, so it's the reason why you wouldn't have any ejaculate post-prostatectomy. They're going to reattach the bladder to the urethra, which is the tube that allows you to pee out through the penis itself. So in that reattachment, there can be loss of urinary control. So that's one of the reasons why men can have some urine leakage at time of ejaculation. There can be some slight shortening of the penis that many of the surgeons won't talk about, and that the nerves that are along the outside edge of the prostate can get stretched, which affect erectile function. So the other thing is, and this diagram doesn't give as good a picture, but the prostate gland kind of bulges into the rectum. And so during anal sex, when the penis is within the rectum, then if the prostate isn't there, there isn't as a tight a passage, so to speak. So that can decrease the pleasure within an anal sex experience. So again, having the prostate out may actually decrease the sexual pleasure within an anal sex experience. So that's ultimately below is how it kind of gets reattached together. But I wanted to kind of go over the anatomy to explain why there are particular side effects that can really affect kind of sexual function there. And the next picture is essentially the prostate sliced like a loaf of bread. And you can see along the outer edge are the nerves. The nerves are going right up against the prostate gland. And during the operation, the surgeon has to kind of peel the nerves off of the prostate. And so those nerves get stretched. And that's why you can definitely expect after the operation, at least for a few months or several months, can have erectile dysfunction. So that the expectation is that you will lose the erections at least temporarily after surgery. And we'll talk about whether this can be long-term erectile dysfunction. The other thing that happens as the nerves get stretched as well, there's that urinary leakage that is expected after the operation. So again, to make sure you're clear about the side effects and what can happen post-surgery. And I want to just kind of talk about the kind of nerve sparing. So most of the time, the surgeon is going to kind of pull the prostate off the nerves off of the prostate glands on both sides. So it's relative nerve sparing, but that's going to stretch the nerves. And so there's always that chance of erectile dysfunction. I think you have to be really clear that, that's certainly a possibility, especially if your erections are starting to wane already, then there's a much higher chance that you'll have problems with erections in the long term. And yes, you can use pills or injections, et cetera, but I think you have to have that very honest conversation with the surgeon to ask about that. In some cases, during this operation, the surgeon can do what they call a true nerve sparing, where they're going to leave just a little edge of that prostate gland in place and be able to spare the nerves better. So you can talk to your surgeon about whether they're able to do a nerve sparing on one side, which will allow you a greater chance of having erections in the long term. And in other situations, the cancer's right flush up against the nerve itself, and the surgeon actually has to take that extra tissue, and therefore the nerves will be 100% damaged and wouldn't be expected to recover. So again, sometimes the surgeon doesn't know until they're actually at the time of the operation itself. But to have that full conversation about whether or not the nerves will be spared and what's the chance of erectile dysfunction. Okay. The other thing, this was very clear from the feedback from our men in the program within the community. They were talking about sexual function, and one of the takeaways is that if the prostate's gone, and then during anal sex, then there's less stimulation on the head of the penis, right? So you have one less kind of, something tightening the canal, so to speak. So that's less stimulation from the prostate gland. The second thing that they wanted to make sure people understood is that at time of orgasm, there's going to be no ejaculate, so nothing comes out. And so for some men in the community, it's very important to be able to actually see the semen come out. That's part of the sexual experience, and to understand that that's not going to happen after a prostatectomy. And the other idea is that, even though you may be able to maintain the erections may not be as good. And, oftentimes the firmer erections are needed for actual anal penetration. So again, to be very clear about possible side effects going into that. The other thing that they mentioned was that there can be some urinary leakage at time of orgasm. So it's a small percentage of cases that happens, but then that can be quite distressing for any man.
Absolutely.
Yeah.
But we can adapt to that. If we knew, for example, once okay, there's going to be some urine while we're having penetrative sex, well, why don't we put some towels, So we can adapt to that one. That can be, and again, it's empowering to know, okay, let's have a conversation about this. Let's see how we can get around this.
Yeah. And not to be surprised in this instance, even though it's a small percentage of the guys. And as I said before, as they kind of reattach the bladder to the base of the penis, the penis can actually get pulled in a little bit. And so there can be actually shortening of the penis by 1 or 2 centimeters. I'm hearing from the surgeons that oftentimes that gut does kind of stretch out with time, but again, it's a known kind of side effect.
And then, of course, is the penile rehab or penile implant. And it's an option. It's definitely an option, especially once, you pass through treatment, the side effects have settled, you have landed where you're at. It's a discussion to have, because this might be a solution for you, something that you might want to do. You might want to not sacrifice your sexual life because of the surgery or because of the treatments that affected you. So have that conversation for sure. We have several men in our program that, when things have landed and, there's some sense of normalcy that's coming in and some reassurance that, everything is fine. It's a conversation to be had. And 7 of our gents in the program are going that route.
The classic penile rehab is actually starting Viagra or the pills like 3-4 weeks after the operation. So there's some controversy within the scientific literature as to whether this helps or not. But I think at least half of the urologists believe that if you can kind of keep that tissue stretched and have erections on the ongoing months while you are actually rehabbing, it actually will help your erections in the long term. And we'll talk about our Kegels program as well, which actually helps sexual health, and we've been able to prove that within our trials as well.
And we'll talk about the intimacy component of our program too, because it's not all sexuality, it's of course intimacy as well, which also gets affected because this whole process, right, the whole journey of the prostate cancer with treatment and side effects and so on. But there are some practical, again, empowerment, information, ways of reframing, learning how to communicate, seeing the glass half full a bit and playing a bit and saying, okay, look, life gives me lemons. Let me make lemonade. There are some ways around this. It's not the end of the world. And I think that's important. It's important to have those conversations as well.
Yeah.
And so we incorporated them part of the program. Yeah.
I wanted to go over the radiation side effects as well. On the left-hand side is a picture of the prostate and the rectum. It's kind of like slicing you like a loaf of bread. So it's cutting right through the prostate gland. The prostate's more on the front side. The rectum's at the back side. And then the colored area is the area where is high-dose radiation. And really what I'm trying to show in this picture is that the high-dose radiation is going to hit the front part of the rectum. So especially for the month or 2 after radiation, the rectum is pretty darn sore. So you wouldn't want to have anal sex during that time. And it's also possible that there can be irritations of that area in the long term, which may also affect kind of receptive sex. The picture on the right-hand side is essentially the same thing, except it's kind of a side view. And so you can see that the bladder is on top of the prostate gland and the rectum is behind the prostate gland. The bottom of the bladder is going to get full dose, so the peeing can be more often or the stream can be slowed down. And as I said, the rectum, front part of the rectum is going to get that full dose of radiation and will be irritated with about a 1 in 10 chance of that irritation being in the long term. So now they have a little bit of background of the possible side effects. And there's a whole other video that I've created which looks at the differences between radiation and surgery. I highly recommend that as part of your educational process. Even if you're not choosing those particular elements, I do want to give you the kind of background so you can have that conversation with your medical practitioner. So the takeaway for you is going into those appointments, the consultations, the follow-ups. Don't expect that your urologist or radiation oncologist is going to raise these topics that may be most important to you. Mm-hmm. They may kind of say, quick little, like you might get erectile dysfunction, and then that'll be the conversation about erectile dysfunction. So I would say if you're interested, and you don't have to do what I'm saying, it's just, one way to kind of go at this is that you can ask very specific questions like, what is my chance of having erection problems in the long term, right? So if your erections are already starting to wane, then I would say on average, most guys in that situation would have very poor erections in the long term. And so that's important to understand kind of going into this. If your erections are really good and you're on the younger side, then there's a pretty good chance you'll be able to maintain that. So that would be one question. If you're having surgery, ask that chance, what is my chance that I'll have to wear a pad in the long term, right? To have some urinary leakage, a year or more afterwards. And if that's super important to you, again, you would want to ask that very specific question.
Yeah. And also very important is to bring somebody with you in the medical appointments. Don't go by yourself. You will be surprised just how your psychology kind of responds to big words like the C word or surgery, or this is going to be affected and that. You're still trying to, the words have hit you. You're still trying to process that information. It takes a while. Meanwhile, the oncologist already passed on to the next sentence and the next set of facts and information. And you just don't have time to adapt and process that as fast. Having somebody beside you take notes, or even asking respectfully, is it all right if I record this? I know I'm not going to remember a word. I just want to land on what you're saying and make sure that I understand what the implications are with this course of action or the other course of action. Right now, everything is hitting me all at once. I'm not sure I understand.
Yeah. And the other one is to be able to recognize if your physician is talking very high level medical language and it's really hard to understand, then you kind of recognize that in practice saying something like, I'm not sure I understand fully. Can you re-explain using simpler language?
Yeah. What does that mean exactly? How is this going to change things for me? Or what are the implications? Yeah.
Yeah. And you can do something else, which is the prostate cancer patient empowerment program.
Yes.
So this is something
10 years of work.
Yes. This is what you can do to really improve your physical, mental, and even sexual health. It's really kind of remarkable that we've been able to do all that. And essentially you have a research scientist to do all that. And essentially you have a research scientist, expert in quality of life, psychology professor, and an oncologist who've treating prostate cancer for the last 30 years.
Yeah.
And we wanted to cover all these elements. We knew guys were at risk of having anxiety and depression afterwards, which makes sense, right? All these kind of changes, sexuality, relationships, all that stuff changes. So the men are at risk of depression, anxiety. We knew that there were particular side effects with the treatment and something you can do something about, right? Erectile dysfunction, urinary leakage, fatigue.
Bowel problems, yes, fatigue.
If you get started on hormone therapy, which is ADT here, there's a whole other set of side effects that can affect blood sugars and lipids and your bone health and so on. So we knew that we wanted to have something that would address that. And lastly, the sad truth is, on average, men are more likely to die of heart disease than of prostate cancer. So doing the program, we want you to change your habits so that you're healthier, stronger, happier in the long term, right? So that's really a big part of this, is because you're going to live likely for decades after prostate cancer diagnosis.
Yeah. And I think most importantly, both Rob and I realize that coming at this with one thing only won't do it. And the literature is very clear. If we just teach you how to, build strength and have those endorphins, flush your body and so on. And of course, that helps in some respects, but not in others. But then there's diet also that matters. It matters what you eat, when you eat. It matters that you adjust your communication, that you are finding ways to articulate how you feel, what you think, and also express your worries or concerns in a manner that is constructive. Well, not everybody is born with that capacity. It's a wonderful feature to have, but hey, we don't all have it. There are issues related to intimacy and sexuality, and communication is key there. There are some practical tools we could have that will help us along the way. So really, one thing won't do it. So instead, we went with the bigger approach, and that is what the science says: make it multidimensional,
comprehensive,
and comprehensive. So this way, patients can take what they need and leave the rest.
Yes.
So that would be a much better fit for the patient than giving them just one component. Let's just talk about sexuality, and that's it. Nothing else matter, right? So very important.
As you'll see on the website, PC-PEP.org, there's an explanation of the program. There's a 10-minute video, which gives a good overview of what happens within the program itself. And then lastly, you can actually sign yourself up right there. So, and this will be a free program till 2028.
Yeah, at least. Yeah. So that's how you sign yourself up. You go on the website, you enter your information there. We take it from there. It's as simple as that.
And then right from day one, you'll probably see this video, especially if you self-identify within the sign up that you're from the GBTQ plus community, then you'll be getting this information and a few other kind of key pieces. We'll talk about this at the end, but we'll be referring you, if you want to men who are part of the community, who are mentors, or you can sign yourself up with another buddy. So we get you to the support groups that will be helpful. And then there's also different educational videos.
Among them is this video that we're creating right now for you. But there are other things, how to navigate the medical system. And we go a little bit into more depth as to, what do you do during medical appointments? What can you do that will benefit you? There's an overview of the program. There is a wonderful video on anti-cancer diet. Again, information that most of us don't know about.
Right, yeah.
When to eat, what to eat. We also connect you as part of the program. It is optional, but we can connect you with 2 other bodies in the program, members from the same community as you, that have gone through the same, more or less, treatments as you, that you can connect with and have the support, in addition to being connected with everybody that is taking the program. And Rob and I on a monthly basis, because on a monthly basis, we get to talk to you live. There's information and education on intimacy and sexuality, and an overview of the program and what you will be doing on a daily basis.
I just wanted to quickly go over the program itself. So once you sign up, we'll set you up to start on the first Sunday of your choice, and it's 182 daily emails. On the right-hand side of the slide here, you can see kind of a description of the things that you can do that day. Again, it's flexible. It's a very comprehensive curriculum. But essentially, you can click on the links to the videos. And then I think the heart of the program, the meat of the program, is actually a daily video from Gabriela and me.
From the 2 of us.
In our kitchen here, encouraging you, describing, prescribing, and modeling, sharing from our lives.
And doing things alongside with you.
Yeah.
So practical things, because, you have all this information from science telling you how you could change your behavior and your lifestyle to better serve you on the prostate cancer journey. But then we need to do it. And so we encourage you how to do it, but we do it alongside with you. And I think really you realize very soon in the program that you're not alone, that really we're all doing this together, and a conversation starts happening. So on a monthly basis, we all get together, we talk about this, we update the science behind the program. So very soon you realize that you tapped into this resource that is not stale, is constantly being updated with what's happening in the scientific community. Also tapping into a very respectful and just dear community of men from all over the world, not just Canada, but New Zealand, South Africa, Europe. Now we just opened the doors there as well. And also men from your own community, the LGBT plus MSM community. And I think that's special. It's important.
So, and just to say what you'd expect is we want you to do some sort of exercise every day, something that's fun, easy, maybe social. and not to sit too much. So even getting out for a power walk would be the kind of recommendation. The second element is actually home-based strength training. So we send you the equipment. It's essentially free to do this program while on trial right now. Mondays and Thursdays, it's about 30-minute videos, 4 levels of difficulty. You can see in the top left-hand corner that Gabriela is doing the easier version. I'm doing the hard. The yoga program is vice versa. you do the hard stuff, I do the easy stuff. So home-based strength training is part of the program itself. Again, tap in the way that you feel is best. Dietary advice. So every day we're helping you transform your diet to a healthier diet. No, you do not have to be perfect, but we do want you to decrease your red meat, increase your fruits and vegetables. We talk about time-restricted eating. We're going to keep harping at you to take your vitamin D every day. There's also pelvic floor muscle training, which is Kegels, which is actually very key for sexual health as well, allowing the erections to get better with time. It's something that we're asking you to do 3 times a day. Extremely important if you're going into surgery because it actually gets you drier faster. And so this has actually been proven from a scientific perspective that this is actually very, very helpful. So again, home-based work. There's a relaxation technique. We'll lend you the biofeedback monitor while on trial, 10 minutes per day based on science, allows those neurons to get rewired so the calmer, more centered, happier you can come out of this. And then key, I think, is really actually talking about intimacy and connection, right? Yeah. So the idea is that every day we talk about how you can connect more with your loved ones, invest in your relationships. Or for instance, there's walking Wednesdays where we ask you to go for a walk with somebody if you can on Wednesdays. There's talk at somebody at a distance on Sundays. And Gabriela does an amazing job talking about intimacy, sexuality, connection, talks about love languages, the role of forgiveness, the fact that we all have emotional needs. And so, and the men actually really appreciate it and love
They embrace this aspect of the program for sure. On a monthly basis, you get to actually meet and be with us. So we have monthly video conferences where we update the science behind the program. But because men have been involved as research citizens in our program and its development from the beginning, we have pre-sessions for each vulnerable population community, including the BGT plus MSM community. And so you have men that have been with us for several years, very much involved in the program, that know all the aspects of treatment from a patient's perspective. And that's quite powerful. And then we have those global sessions where there are men coming from all over the world that are taking currently the program. We do scientific updates, and then we talk in groups. Then we bring the knowledge and the information to the whole group. We connect with one another. Rob and I are always the last ones to leave the monthly video conferences. So if you need to talk to us one-on-one, you can. We have a Facebook group. We have an archive of all the live events that we've given over the years. So I think that's very powerful in and of itself.
So given the feedback from our men in the program as part of the community, we've been able to change the program even from now. So right from time of coming into PC-PEP, you have the option of connecting with other men within the community, whether they're mentors or buddies who are the co-participants who you can do the program with. You'll see on the website that there's actually a web page that's specific for the community as well. And you'll see on that web page podcasts from men within the community.
Very powerful.
There's a list of mentors there that you can kind of choose in some sense. But we'll take care of you in the way that's best for you and maintain your confidentiality. And as Gabriela said, there's a monthly video conference. Prior to that video conference, for the 45 minutes just prior to, there's what we call a pre-session. And the men within the community said that it was really, really helpful to be able to go in and talk to other men who are part of the GBTQ plus community and learn from them and connect with them and be supported with them.
Yeah.
We're also going to, again, a feedback from the team was that it would be nice to have a gay urologist join that so you can ask some specific questions. So we're aiming to bring that person in probably twice per year and make sure that your needs are being met. Yeah.
Yeah.
Wanted to actually share some exciting science that we've done here. So right now we're in the midst of a very large international trial. It's what they call the implementation trial, where we're trying to figure out if this is going to work in multiple different communities and
Mhm.
countries and cultures, et cetera, et cetera. And we have a comparison of the outcomes of the trial, the 6 month program of the 15 men who are part of the community versus 402 other participants. So all of these people, the 417 people that you see here, have all done the 6 month program, and they've all filled out the quality of life surveys at the start and at the 6 month point, and so on. And so this is kind of looking at how the men in the community did versus others. And it's really exciting to see, right?
Yes, first off, you're seeing that overall, gay men and men having sex with other men that belong to that community also rate the program a little bit higher
9.1
than
versus 8.2.
most men in the program. And Rob and I have been scratching our heads and saying, how can that be? And I think a lot of it has to do with so much information that is perhaps much more needed in the GBTQ plus men SM community than for heterogeneous men. And I think part of that empowerment piece is reflected in the ratings of the program and how important it is to be part of the program compared to just going through usual care, how much lifestyle changes being part of the prostate cancer patient empowerment program, recommendations to other men to be part of the program. How useful are the daily videos, for example, 8.9 compared to 7.8? How useful were the exercise videos and encouragement, 7.9 versus 7.3, and so on. So you go through those ratings, and it becomes quite clear that men really benefited from the program and are benefiting from the program.
Yeah. Look at this one, this on the end here.
Yeah.
How useful was being connected with a buddy?
Mm,
9.2
two.
in
Yeah.
the GBTQ plus
It gives
community
me
versus
that information.
7.3
Three
in
in the
the
other,
others, right?
yeah. And I guess it really points towards an unmet need because
Yes.
we talk
Connect
about,
you with,
specifics,
yeah,
how not having a prostate affects you
yeah,
when you're having sex, for example. Those are important topics. Where are you going to have those
yeah.
conversations? In the doctor's office? Maybe yes, maybe no. And research shows that maybe no is the norm.
Yeah, makes sense. And then we actually looked at how much benefit the program had. So we measured what they call psychological distress, which is anxiety and depression.
Yeah.
Measured it at baseline, which means just at the start of the 6 month program. And then we measured it at the 6 month point. So after you finish the program, how much different what was it?
And have a look at the results.
And I just want to say that
Yeah.
the men at baseline in the GBTQ plus had higher levels of distress and anxiety.
Yeah.
19.5 versus 15.7. That's a really big difference between the two sides. So the
Yeah.
guy in the gay bisexual communities have high levels of anxiety at the start, but they were actually able to make themselves feel a lot better by the end of the 6 months.
A
That's
5-point decrease,
incredible.
that's pretty good.
Yeah.
Yeah, that's wonderful,
It-
truly.
it-
And then anxiety, the same thing, much higher anxiety at first, 5.6 compared to 3.4
Yeah.
in the other men group. And again, you're seeing a 3.1 points reduction.
Yeah.
Self-efficacy,
Was
right?
very, very similar in the
Was
two
very
sides.
similar in the
Yeah.
two sides.
Next slide, looking at specifics.
Mhm.
So we looked at well-being overall. It seemed like they were very similar,
Very
the
similar
two
to the two
sides.
groups.
Not much change overall.
No.
Even despite them going through all that treatment, they're able to maintain that.
Yeah.
The EPIC function, urinary function, so how well you were peeing, for instance, it was pretty darn close at the start, but it seemed like the men in the GBTQ plus community actually benefited a bit more by doing this.
Yeah, so you see urinary function was better, of course, at the baseline, but then you have radical prostatectomy, you have radiation treatments that really affect both those functions, urinary function, especially after radical prostatectomy, sexual function for both.
Yes.
And you see, of course, there was an expected decrease in both those domains, but you see the decrease to be more pronounced for urinary function for gay men and more pronounced for sexual function for other men.
Yeah.
So that's important. I guess, empowering men with specific information and tools as to what can they do so
Yes.
that they don't take such a big toll in terms of their sexual function. It's important.
Yeah.
And this data really shows that.
Yeah, really
Yeah.
making a difference.
Yeah.
So, yeah, so we're very excited for you to join the program. Please join us at PCPEP.org. We will connect you in the ways that is best for you. And we really, really hope you join our monthly video conferences, connect with mentors and buddies if you want, and really make a difference in your health in the long term.
Let's empower you so that you may empower others.
Yes.
Together we grow, and we grow stronger together.